We'll get started. I'd like to welcome everyone to today's GlomCon seminar series. I'm Dia Wagisbeck in Houston. Today, our talk is titled Chronic Kidney Disease and Autoimmunity, and we are very excited to welcome our speaker, Dr. Andreas Kronbichler. Dr. Kronbichler is the professor and director of the Department of Internal Medicine for Nephrology and Hypertension at the Medical University of Innsbruck in Austria. He is the editor-in-chief of the Rare Kidney Disease Journal and the chair of the Immunonephrology Working Group of the European Renal Association. His research focuses on immune-mediated kidney disease with a particular focus to improve kidney and overall outcomes of patients. And he is a supporter and contributor to our educational mission here at GlomCon as well. We're very thankful to have him with us.
Thank you, Dr. Wegersbeck, for your kind introduction. I think this topic is a bit difficult to really shape, and I would say that everybody of us talking about it would tackle it from a different perspective. So these are my disclosures, and as mentioned before, and also in the chat, I think it was mentioned the Rare Kidney Diseases Journal is up and running now, and we would welcome submissions, and also from my side, Happy Mother's Day to all the mothers celebrating today. So Rare Kidney Diseases, the journal has been live since January, but now I think we are in full swing. And one of the ideas, and Dr. Glassock is on the call today, is that we would like to transcribe some of the Sunday seminars, such as this one here, into articles for the journals, like a mini review or an in-depth review. And this can be done by large language models, just reaching out to me or to others, asking for PDFs, putting it into ChatGPT, and then see how we go from here. It will require a lot of individual work, of course, but I think speakers like myself would be very happy to help and to shape this into a full-length manuscript. So we will start with what's really like close to our heart as nephrologists, just to recap the definition of chronic kidney disease, because that's important. And we have heard about Nefecon before, and we will also talk a bit about IgA nephropathy. We will talk a bit about ANCA-associated vasculitis, anti-GBM disease, and then secondary immunodeficiency, because this is something we're overlooking when our patients present with CKD. So criteria for chronic kidney disease, this is something we are very well aware of, but it's important to acknowledge that, of course, markers of kidney damage is predominant here, and especially if you have albuminuria, which is persistent for a minimum of 3 months, that's driving basically CKD diagnosis in the general population. We have, of course, urinary sediment abnormalities in GN, also persistent hematuria, kidney biopsy, and also patients, of course, after kidney transplantation. And it's particularly important for us in autoimmunity is, of course, also the section on decreased GFR, especially if we talk about ANCA-GN, especially if we talk about anti-GBM disease, for instance. Many of our patients will have established decreased GFR once they are diagnosed with the disease. And this is just the CGA, which is proposed by KDIGO, and you're all aware of. And I think it's always important to acknowledge that and also put this into our discharge letters for patients and explain what it means to have basically here or belong to one of these red fields, so high risk of progression to end-stage kidney disease. And this translates into, of course, also poor outcomes, such as all-cause mortality indicated here, myocardial infarction, cardiovascular mortality, or stroke, which is also in the KDIGO guidelines. And you see from left to right and from top to bottom that there is an increased risk. And here, albuminuria is subdivided below 10 to 300 and plus. And GFR here is also subdivided, and they used the 2012 GFR creatinine and cystatin C formula to establish GFR. So you see that like the risk here is 8.6-fold increased when you have a GFR below 30 and albuminuria over 300 milligrams per gram creatinine when it comes to all course modality.